Hello, everybody, and welcome back to another episode of A Fresh Perspective with Jeff Charles, where we prefer truth over narrative and principles over politics. Now, before I get into this part of the debate between Trump and Harris, you know what you got to do. You got to subscribe. You got to like this. You got to share this. All that great thing. All that great stuff. I mean, what are you waiting for? I mean, I'm not saying that you're missing out on the best thing since sliced bread, but well, no, actually, I am saying that. That's exactly what I'm saying. Hit that subscribe button. Share this with your friends and family and everybody who you love, and even your enemies. They might appreciate it too. But let's talk about one aspect of the debate between Donald Trump and Kamala Harris, specifically when it concerns healthcare. Now, y'all know I've been talking about this quite a bit, but when that topic came up during the debate, it was absolutely hilarious. You know, it's kind of like the humor where nobody actually has a real plan, but they like to pretend they do. Yeah, that's what went down. And both candidates were horrible in their answers on this. So let's dive into this. So one of the moderators, or actually one of Kamala Harris's debate partners, asked Donald Trump if he has a plan for healthcare. His answer was about as bad as it gets. First off, he ended up saying when he was pressed on it, he says, well, I have concepts of a plan for healthcare. What the hell is that, Trump? Then he goes on talking about how Obamacare was lousy healthcare and that if he were to come up with a plan, which he hasn't, then it would be better than Obamacare and make things more affordable, blah, 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 yakety schmackety. His answer was basically, well, we might come up with something at some point if the stars align and the magic healthcare fairy finally delivers the goods. Bruh, it's been like, what, 9 years and still no plan? And I'm not even just targeting Trump on this because Republicans in general had a chance to overhaul Obamacare, to replace it with something else, or what I would prefer, replace it with nothing except the free market. But the man's had almost a decade to cook something up, and so has the Republican Party. But all we've gotten so far is vague talks of concepts of a plan. Now, I'm not sure, I don't know about you, but these concepts don't exactly inspire confidence when you've got a $3,000 emergency room bill staring directly in your face. And he's been riding on the same train since his first run for office. You know, he bashed Obamacare, promised something better, and then when it was time for details, it was more like, That's basically Trump's healthcare plan. It's that's what it sounds like to me anyway. Um, but Kamala Harris is no better. You know, she's no better. You know, she talks about how they've strengthened the Affordable Care Act and how they want to strengthen it even more. They want to make Obamacare even more intrusive, or have the state be more intrusive in healthcare. It's already intrusive enough. It's too intrusive. But basically, she wants to turbocharge Obamacare into the next phase of government healthcare. Now, here's the thing. This is yet another one of those bait and switch things that people do, especially the Marxist crowd, when they really want to advocate for universal healthcare provided by the government. She has advocated in the past for doing away with private insurance and having that all be handled by the government. Now, I understand that she's been pretending to move back from some of those positions. She's a damn liar. We all know it. She has the exact same positions. She's just trying to move towards the center so that she doesn't scare off people with common sense. So basically, if she gets her way, if you like your private insurance, you better say goodbye to it. You better use it up right now, because if she manages to get her way, like say if Democrats take over both chambers of Congress, we've got some really bad things coming down the pike. But again, Trump is no better. I mean, there was an NBC article saying that he's basically just kicking the can down the road. So the bottom line is that both sides are playing this game of, you know, who can throw the most government into the system. Because don't make no mistake, Trump isn't advocating for a free market healthcare system. I mean, he's really not advocating for any healthcare system, but whatever he comes up with, even given his statements in the past years ago, he's not trying to get the government out of healthcare. He just wants to do it differently from how Democrats want to do it. So why don't we talk about what actually needs to happen? You know, since our politicians and our government officials aren't really interested in what needs to happen, you know, the key to fixing healthcare is not more government. It's less. Less government, more freedom. People need to keep more of their hard-earned money instead of having it stolen by the government, ostensibly to be used on healthcare. When some bureaucrat decides when it's your turn to see a doctor, then you have a problem. This solution is about empowering patients, not the government, not big pharma. If you want real change, you got to bring back the actual patient doctor relationship that we used to have back in the day. Allow people more control over their healthcare decisions and how they use their own money to pay for their medical services. We have to have more competition, more innovation, and we only get that through using the free market. We need to free up the healthcare market, get the government out of it. All these policies that they pass are supposedly intended to make it easier for people to get the care they need, but in the end, they just make it harder. If you're worried about rising healthcare costs, which you probably are, you can thank the government for that. I'm not saying it's all the government, but there really is a huge collusion between major insurance companies and the state and big pharma, and they are the ones who decide what kind of care you're going to get and from whom. The reality is that you should be the one to decide. We need to empower patients, not the state, right? Okay, so I'll leave it there. Before I sign up, you know what to do. You got to hit that subscribe button. I'm just going to remind you really quick. Also, check out my Substack, Chasing Liberty. You can access that at libertychasers.com. Become a subscriber. Support my work. I have a bunch of my writings over there, a bunch of my videos, yada, yada, yada. Check it out. Check out my witty insights and hard-hitting commentary. If you don't, well, then I might have to draft my own healthcare plan. And you don't want to do that because I might. Then again, as bad as I might be, I'd probably be better than Trump and Kamala Harris. All right, I'll leave it there, guys. Thanks for listening. Let me know what you think. Until next time, stay free, stay principled, and most importantly, stay ungovernable.